Hey everyone, welcome back to Dr. Monomics. Today, we are diving deep into a very important health topic, celiac diseases. It's a condition that affects millions worldwide and often goes undiagnosed. In this video, I'll be explaining what celiac disease is, its symptoms, how it's treated, and how to manage it if you or your loved one has it. So, let's get started. So what is celiac disease? Celiac disease is an autoimmune disorder that primarily affects the small intestine. When someone with celiac disease eats gluten, a protein found in wheat, barley or rye, their immune system mistakenly attacks their own intestine, particularly the small intestine. This immune response damages the lining of the small intestine, leading to malabsorption of the essential nutrients. Now, why is gluten the problem? Gluten is a common protein in many foods, especially those that contain wheat, barley or rye. For people with the celiac disease, gluten is harmful because it triggers an immune response that damages the small intestine villi. So what are the villi? Villi are tiny finger-like structures lining the small intestine that help absorb nutrients. When these villi are damaged, it becomes difficult to absorb nutrients, leading to various health issues. So what are the symptoms of the celiac disease? Symptoms of celiac disease can vary widely between individuals. Some may have severe symptoms, while others may have almost none. Even though damage is still occurring in the body, let's break it down some of the common symptoms. First one, the digestive symptoms. In digestive symptoms, diarrhea, constipation, bloating, gas or abdominal pain, nausea, vomiting, fatty falling smelling stools, also called as steatorrhea. These are the digestive symptoms of the celiac disease. Number 2, nutritional deficiencies. Iron deficiency anemia is common, leading to symptoms like fatigue, paleness and dizziness. Calcium and vitamin D deficiency increasing the risk of osteoporosis and brittle bones. Vitamin B12 deficiency, which may cause neurological symptoms like numbness, tingliness, or trouble balancing. Number 3, non-digestive symptoms. Now look at the non-digestive symptoms of the celiac disease. It includes skin rash, especially a type called dermatitis herpetiformis, and itchy, blistering rash, often seen on the elbows, knees, and buttocks. Joint pains and muscle cramps, headaches or migraines. Mood changes such as depression and anxiety, dental problems like enamel loss or discoloration. Other symptoms of non-digestive symptoms like growth issues in children as nutrient absorption is compromised. So now, what are the diagnoses of celiac diseases? If you suspect celiac disease, the first step is to consult a healthcare provider. Diagnosis usually involves a few key steps. First one, the blood test. First line of testing include blood tests that check for specific antibodies like anti-tissue transglutaminase and anti-endomysial antibodies. Elevated levels of these antibodies suggest that the immune system is reacting to gluten. Number 2, endoscopy and biopsy. If blood test indicates celiac disease, the next step is usually an endoscopy. In this procedure, a doctor uses a small camera to examine a small intestine and takes biopsies or small samples from the lining of this small intestine. Damage to the villi confirm the diagnosis. Number 3, genetic testing. Some people may also undergo genetic testing for HLA-DQ2 and HLA-DQ8 genes, which are present in almost all individuals with celiac diseases. However, this test alone can't diagnose the disease. Note that it's essential not to start a gluten-free diet before testing, as this could lead to false negative results. Now, what are the treatments of the celiac diseases? Unfortunately, there is no cure for the celiac disease, but the good news is that it can be managed effectively. The primary treatment is strict, lifelong, gluten-free diet. Number 1, gluten-free diet. A gluten-free diet means avoiding foods and drinks that contain wheat, barley, rye, or any derivatives of these grains. Foods like bread, pasta, cereals, baked goods, sauces, soups, or even some processed meats may contain hidden gluten. So, reading labels is crucial. Number 2, nutritional supplements. Since celiac disease can lead to deficiencies, especially when first diagnosed, doctors often recommend supplements iron, calcium, vitamin D, vitamin B12, and folate are common supplements. Number 3, the medications for symptoms. Though diet alone can often help manage symptoms, some people might need medication. For example, steroids may be prescribed for the short period to reduce inflammation in severe cases. Number 4, skin rash treatment. For those who have dermatitis herpetiformis, a gluten-free diet will generally clear up the rashes. Doctor may also prescribe a medication called Dapsone to help relieve itching. Number 5, follow-up care. Regular follow-up appointments with the healthcare provider are essential to monitor nutrient levels, check for improvements in symptoms, and ensure that the intestine are healing. Now, managing celiac disease involves a lifestyle shift, especially when it comes to diet. Here are some tips for living well with celiac. Number 1, reading labels. Look for gluten-free labels on packaged foods. Be cautious with foods that may have hidden gluten, like sauces, dressings, or flavoring. Number 2, avoiding cross-contamination. Cross-contamination can happen if gluten-free food comes into contact with the gluten-containing food. Even in small amounts, using separate kitchen tools, toasters, cookware can help. Number 3, dining out. Eating out can be challenging, but many restaurants now offer gluten-free options. It's essential to ask questions about food preparation and ingredients to avoid accidental exposure. Number 4, connecting with support groups. Joining support groups or online communities can provide emotional support, share tips, and offer advice on dealing with everyday challenges of living gluten-free. Number 5, educating family or friends. It's helpful if your family and friends understand what celiac disease is and how it affects your life. They can be more supportive, especially in social situations. So now, what are the complications of untreated celiac diseases? If celiac disease is untreated, celiac disease can lead to severe health complications. This includes malnutrition. Persistent nutrient deficiencies can lead to malnutrition, affecting the immune system, bone health, and energy levels. Number 2, bone health issues. Osteoporosis and osteopenia are more common in people with the untreated celiac due to poor calcium and vitamin D absorption. Number 3, infertility and miscarriage. There is a link between untreated celiac disease and reproductive issues, including infertility or recurrent miscarriages. Number 4, neurological issues. Untreated celiac can lead to nerve damage, causing tingling, numbness, and other neurological issues. Number 5, increased risk of certain cancers. There is an elevated risk of cancers such as intestinal lymphoma and small bowel cancer in people who don't follow a gluten-free diet. So now, what are the prevention of the celiac disease? Can it be done? Currently, there is no known way to prevent celiac disease since it's influenced by genetics. However, early diagnosis and following a strict gluten-free diet are key to preventing complications. So, what are the future celiac disease treatments? Researchers are exploring alternative treatments such as medications to help digest gluten or therapies that might one day make it possible for people with celiac to tolerate gluten. But as of now, they are still in development and may take years to become available. So everyone, that's all you need to know about celiac disease, from symptoms and diagnosis to living a healthy gluten-free life. We covered it all. If you have any questions, feel free to drop in the comments below. And don't forget to like, share, and subscribe to Dr. Monomics for more health insights. Living with celiac can be challenging, but with the right information and lifestyle changes, it's entirely manageable. Thank you for watching and take care of yourself.